I just let it ring and I just froze. And I said to my husband, he called, the surgeon just called, and then Jonathan said, why didn't you pick it up? And I just said I was too scared. My name is Katie. My diagnosis was stage 3B colon cancer. I am a mom. I have 3 beautiful teenagers. My oldest is 15, and then I have I have twins that are both 13. I live in the heart of New York City, have always been a very career-driven woman. The summer of 2022, so about a little over, about 2.5 years ago, I got COVID. And then I would say 2 months later, I got strep throat. And so I was really, really run down from COVID. I thought I was experiencing long COVID and then the strep. And I just thought it was some sort of viral thing that I couldn't shake. And that was when there was a lot in the media about long COVID. And I just sort of convinced myself that that's what was going on. And I was also getting heartburn. Um, but other than that, there was really nothing else from a GI perspective that was abnormal, which was very interesting. I, I've always had stomach issues. And so I just, you know, nothing felt unusual. I was staying the same weight, I was eating as usual, but I had this absolute extreme fatigue where I'm used to walking all over the city, picking up my kids 8 blocks away, going here, going there. And I just found myself deeply out of breath when I tried to walk 2 blocks. So I thought, it's viral infection or I'm just really, really run down from work. And so I went to the doctor and a PCP, and I told her that I couldn't get over this strep throat. And she said, okay, well, let's do some blood work. Your throat is a little bit red. And so she did blood work. And the next morning, she called me and she said, you need to get to the emergency room now. Your your blood levels, your hemoglobin is so low that I honestly don't know how you're moving. And I do hear this a lot from women who've had colon cancer because you become very anemic because of all the blood loss. The thing with me though was I wasn't losing blood out of my body. So a lot of people find blood in their stool. That was not my case. So when I went into the ER, they did do a battery of tests, and they did like a fecal analysis, and it showed no blood. So they kind of were like, well, it's probably not like, a colon. They didn't say colon thing, but they said, they didn't think it was something where I needed to get a colonoscopy immediately. Um, so I left the hospital basically with no treatment plan. Um, my PCP had told me to take iron pills. So I started iron pills, and I went to see her about 3 weeks later, and my iron was still drastically low, my iron and my hemoglobin. So it's still considered incredibly anemic. So then she had me go through, she wanted more testing. I, being at that sort of perimenopausal age, thought that maybe I was losing blood just from heavy periods. I was just kind of rationalizing it all in my head in different ways because I just couldn't figure out what it was. So they started me on an iron infusions. So I was scheduled to have 4 iron infusions, which was awesome because it really, really took away the fatigue. Um, and I started getting other tests at that time. So I got an endoscopy. They looked down my throat. I went to the OBGYN and had a series of tests, pap smear, pelvic ultrasound. And then the last test that they decided to give me was the colonoscopy, which I'd not had one yet at that point. I had done a series of 4 iron infusions. I was feeling like $1 million. And so I thought, okay, this journey's over, but it's probably time that I get a colonoscopy anyway. So I went in without a worry in the world and had an excellent GI doctor, Dr. De Lopez, her name was or is. And she did the colonoscopy. And when I woke up, um, I basically woke up to her saying, Katie, you have colon cancer. And I was just like, coming out of the sedation. And I was like, what? I couldn't believe it. And she said, you have colon cancer. And I said, how do you know? And she said, well, you have such a large tumor in your transverse colon, which is the part of the colon that sort of goes across your body. Um, she said, you have such a big colon that I couldn't even get a pediatric scope around it. Um, and was like, she said, but I can't give you that official diagnosis because um, we needed to do a biopsy, so we don't have those results. But in my 25 whatever years of practice, I'm pretty sure you have colon cancer, and I've already called the oncology surgeon over, and he's going to be meeting with you in about a half hour. And so she said, call your family. Can you get your family here to be with you right now? And so I called my husband and I just said, I have colon cancer. You need to come to this clinic or this place I was. And so he rushed over and I called my mom, hysterical. I was just like, I have colon cancer. And I just could not believe what was happening. It was so scary. And cancer was always one of those things where I always was afraid of getting cancer. I had this irrational fear. If I had an earache, oh my God, what if I have a tumor? If I had, it's just, I've always been deeply aware of it and afraid of it. And it's just one of those things. And I just couldn't believe that this was actually happening. So my husband got there, the oncologist got there, oncology surgeon, and he said, well, I can't confirm you have colon cancer. Because I need to see the pathology report. But I want you to come to my office in 3 days and we will talk about everything. I'll have the results by then, etc. Uh, so I just went home and I got a FaceTime with three of my closest friends. And I just got on the phone with them and just said, help me. I went to see the oncology surgeon a couple days later, and I went into his office, into the exam room, and the nurse practitioner was in the room with me, and she was filling out the chart. Her screen was right behind her, and she was just typing away. And I looked up at her screen, and in like big red font, it said cancer patient. So I was like, okay, I guess that's me. I guess I have cancer. And this is where we're doing this, people. So it's just like this is my reality. And so it was kind of like my soft launch into knowing that it was true. And then he came in and I was ready to hear it because I had just read it on the screen. The treatment plan was surgery. I feel very, very lucky to have gone to the surgeon that I did because he was the top, colon or GI surgeon at his practice. He'd been doing it for a gazillion years. He said he's done over 1,000 laparoscopic um, colon resections. And so I went into him, and he gave me some very like Xerox paperwork because I had I had adenocarcinoma, which is sort of the basic kind of cancer, colon cancer that you can get. So it's the good kind, I guess, if you would say. Um, so he already had all the paperwork, and you could tell that he knew his spiel. He had said it 1,000 times. I was fine with that. Like having a doctor who has done it 1,000 times felt very good to me. I didn't want somebody that was brand new. Um, so so he said, you're gonna, you'll have the surgery, and then we need to see what what will come after that. Most likely it's going to be chemotherapy, but he needed to do tests to see if it had metastasized. So after I went to his office, that was the next big thing, is to do the CAT scan. And so they did the CAT scan, um, and blood work, um, to check like CEA levels, which is a colon cancer marker. And we were going to talk a couple days later after he got the results. So a few days later, I was waiting to get the CAT scan results and the blood work. And to say that I was afraid is such an understatement, because I had done like novice move. I Googled everything and anything possible. And so I knew, holy moly, if this metastasizes, my chances of survival are not great. And I was very scared by that, especially knowing that I had such a large tumor. When the surgeon called me that night at about 8 o'clock, I picked up my phone. I was sitting with my kids. Nobody knew what was going on. And I didn't answer the call because I wasn't ready to hear if it had metastasized. So didn't, I just let it ring, and I just froze. And I said to my husband, he called, the surgeon just called, and then Jonathan said, why didn't you pick it up? And I just said I was too scared. So I read his voicemail before I listened to it, and I saw words like the best possible outcome. This is great news. And so I was like, thank God. So I called him, and he said, Katie, you're very lucky. He said, your CEA is like off the charts because it should be below like 4, and mine was 121. He's like, but it has not metastasized, and this is the best possible news we could get. So we're going to do your colon surgery, and then you'll have your chemotherapy, and I'm confident you're going to beat this. I went in for the surgery, and it just felt like, you know, maybe getting like a minor surgery, the prep for it. Um, at that point, I didn't know what sort of lymph node involvement there was. He said that I had one enlarged lymph node, and I was like, what does that mean? Is there cancer in my lymph nodes? And he's like, I don't know yet. We need to get in there and see what's going on. He was so kind of laid back about it that I took that same approach. So went in for the surgery and was optimistic up until the moment that I had to go from the waiting room, not like a regular waiting room, but like the prep room. I walked into the room where they did the surgery. They don't wheel you in. I walked in, and you just walk into this huge room with the operating table and the machines and equipment, and it was really cold in there, and I was just like, okay, this is serious. I'm about to get surgery, and I don't know if I'm going to come out of this with an ostomy bag. I don't know if I'm going to come out of this, if they're going to have to do laparoscopic, or they're going to have to open me up. You don't know at that point. what you're going to be going, what's going to happen when you wake up. So I just started crying and I was so scared going in. And everybody in the operating room was just like, lay down, put your arm out. It wasn't, it was just like, okay, we're here to do our job and you're going to be asleep. They were probably thinking, you're going to be asleep in like 2 minutes. So, we're not going to sit here and try to give you hugs. Let's just get this on the road. So I was like, oh my God, uh, put me out. I just wanted to be like put to sleep. And so it was, I think about a 6 hour surgery. Um, and when I woke up, my first question is, do I have an ostomy bag? Um, the answer was no. And the surgery went very well. And they wheeled me into my room. I had a roommate, and I just was so freaked out after the surgery that I had just had a third of my colon removed. After my surgery, I had the choice to do chemotherapy. They give you a choice. They gave me a choice. I don't know if that's normal. Um, and I decided that absolutely I'm doing chemotherapy. Surprisingly, you'd be shocked the percentage of people that don't actually go on to do the chemotherapy. They just, there are cure rates. Some people are cured by surgery alone. They told me that I needed to do the infusion 6 times. They told me that the best way for me to do it was to get a port installed, which I still have. It's right here. And I'm just really impatiently waiting for the day that I can get it taken out. Every time I see my doctor, I'm like, so can we talk about this port? Um, and he keeps on putting it off. So they really wanted me to get the port, and I was just really, really hesitant to get it because it just made me really feel like a cancer patient. And I was like, I have good veins, just do the vein. And, because I just wanted to make it go away. They finally convinced me that the port was the best option because it can really, really mess up your veins if you keep on putting these very toxic drugs through it. So I got the port installed. No big deal. You go in, they give you like twilight, you fall asleep for a very short amount of time, they put it in, you leave, and then you have a port. And it definitely was like, didn't like having the port. Every time you look in the mirror, you're looking at your port. But we named my port Portia, and me and Portia became very good friends. And it was actually like being able to just go into the infusion center, use the port to get my chemo, use it for blood draws was really, really easy. And I'm glad that I didn't go the vein route. So the, the drug regimen, like I said, I worked through all of my chemo. So while it really stunk and it was not fun, um, it was manageable. And what I mean by that is I would have I'd go in, get the infusion, and start my oral therapy around the same day. You feel pretty crummy after that, although they give you steroids, which really helps. But once the steroids wear off, and now you're just on the oral medication, you really feel pretty crummy. And what that looked like for me was nausea, um, extreme sensitivity to cold. It was the winter. I live in New York. And when I say sensitivity to cold, it would be when I would go outside, my face would literally freeze into place. Like if I was smiling, I and my face froze, it would just stay smiling until I got warm. So that was kind of funny for me and my family because I had my mouth open, like surprised about something, like, and then I'm like, I couldn't close my mouth for like a few minutes. And it was just really freaky, but kind of funny too. Um, And the cold sensitivity to drinking was a real thing too. When I would drink anything that was not room temperature or warmer, it felt like shards of glass going down my throat. So that really was no fun. Ate very, very bland foods, potatoes. Yeah, a lot of potatoes. Um, I lost quite a bit of weight. Um, and they just were, every time my sister visited me, she'd just say, please eat. She just was begging me to eat. So you just feel nauseous, a lot of nausea. One thing I will say is that I did the Signatera ctDNA testing. I highly recommend the ctDNA testing. I found it to be very comforting to get those results. Um, I had negative results since post surgery. My ctDNA tests were negative, and everything I'm reading, that is the most sensitive test in terms of microscopic levels of cancer in your bloodstream. And so getting that result was just really, really took the edge off and took the anxiety down a lot. I was NAD. Nobody really used that term with me. Um, but I mean, actually, maybe my oncologist did. Whenever I met with him, he would say, your numbers are great. Everything looks great. We're not seeing a reoccurrence. I didn't have one moment of pure celebration, because everything just felt like, for now, you're still going through your treat. Like, I just never felt quite right to celebrate. And I don't know that I ever will until I hit that 5 year mark. Um, I'm not saying I don't have joyful moments, but I'm a little superstitious about going over the top with the big celebration. So every time I have, clean scans, a good Signatera, I definitely call 100 people, not, my five closest friends, my mom, my sister, and my family, and let them know what's going on, and, have my own little moments with each of them. My treatment ended in the summer of 2023. So a year and a half ago, my treatment ended, and that was amazing. Uh, that was I was able to go through the summer. Really, I went to the Poconos with my family for a month. My friends came up, and I just was trying to heal in many ways. One way, I was so weak from not exercising, so I started exercising and just emotionally heal from how traumatic it was to go through this journey, and just, yeah, really heal from it. So that was just phenomenal. But you always have in your mind, but I've got another doctor appointment in 2 months. So I celebrate in small ways. I get back to life, and then I'll get some sort of reminder that I have a doctor appointment in 2 weeks or whatever. And then the anxiety comes back, and then the worry comes back, and I relive it more in my head. And then I get the blood work or the scans, and then I worry until that's over. And then I celebrate, and then I go back to normal. And then you got more tests. So it really is sort of cyclical. But the moments of normalcy get longer and longer. The anxiety lessens, the really intense fear lessens, and but it's always still there. You've heard of a scanxiety. That's a real thing. So yeah, so I really just started to just try to get healthier and healthier. Now at this point in my life, I'm at the gym 6 to 7 days a week. I'm doing Pilates, bar classes, some cardio. I've never felt healthier. When I got this diagnosis, I went online to find a therapist, and I stumbled across somebody that was spectacular. She's a health psychologist. So she specializes in dealing with people who have some sort of um, health condition. And I've been seeing her every week since my diagnosis. I do not miss a session with her. And so she taught me how to overcome the fear of the unknown, and not even overcome it, but how to live with it. Because when I would say, Dr. Cohen, I could die. I I don't know if I'm gonna die. And she said, we're all gonna die. You just you might know your date when other of us don't know our date. That might sound morbid, but it helped me. And she just taught me how to say, okay, I maybe got a bad test result, but I've overcome so much so far. I can deal with this. I have it in me to cope with this. So therapy has kept me going and kept me focused on the things I want to focus on. Um, Being very in the moment. I decided that 2024 was my year of never saying no. My other piece of advice is, um, again, this is going to sound like an obvious, but is to lean on people, but not just like friends and family. I actually became close with our rabbi. I called her and I said, we set up a Zoom call, and I said to her, Rabbi Frisco, what happens when you die? Because I didn't know in Judaism what happens. And so her and I started talking about that and talking about life. And I leaned on her, and I leaned on somebody that I met, my mother in law's friend's daughter, who was my age. And she also had colon cancer. Her and I became close, and we text and call each other all the time now. So finding support in unconventional ways, I think really was really beneficial for my healing and my sanity, really. Having cancer is such a personal thing. When I was going through it, when I was diagnosed, and then when I was going through treatment, I really didn't tell many people, because I wanted to keep it private. And that was how I wanted to handle it. I have a friend who she posted her whole journey on Instagram, and that was how she handled it. So I don't think there's any right or wrong. But I just didn't know at that point how much I wanted to make it part of my identity and part of who I am. And so I think we all just need to make that a personal choice and make sure that other people understand and respect that.